So we're going to do a postpartum assessment, and to do that we're going to use the BUBBLE acronym. That stands for breasts, uterus, bladder, bowel, lochia, episiotomy, and or perineum. So we're going to start with the breasts. So we're going to observe for the size, shape, and reddened areas. We want to know, are the breasts soft? Are they filling? Are they full? We want to palpate for warmth, engorged areas, hard lumps, or blockages. We also want to examine the nipples for redness, cracks, bleeding, or fissures. So are the nipples soft? Are they sore? Are they tender? Are they bleeding? Are they flat? Are they inverted or everted? We also want to know, does the baby have a good latch, or do clients state that it hurts all the time when the babies latch onto the breast to feed? So in non-breastfeeding, we want to evaluate for breast discomfort and the filling. We want to remember that heat helps promote lactation and cold will slow lactation. So the second one is uterus. So we want to check the fundus, and it should involute about 1 centimeter per day. The fundus should be firm and midline, not boggy or soft, and we want to support the lower uterine segment before we begin palpating. But before we start palpating anything, we want to listen to our bowel sounds. So for the bladder, we want to observe the contour of the abdominal wall above the symphysis pubis here, and we want to palpate for distension. We'd ask how the client is voiding. Is it normal? Is there urgency? We'd ask them to do their Kegel exercises and explain how to do that if they need. For the bowel, as I said before, you can auscultate the bowel sounds. So when you auscultate the bowel sounds before you start palpating, you want to start in the lower right quadrant and then work up to the right upper quadrant, then the left upper quadrant, and then the left lower quadrant, and make sure that you hear sounds in all 4 quadrants. We will also want to ask about their normal bowel habits and ask about their nutrition, like has the client increased their fiber intake. For lochia, we want to assess the amount, the color, and the type, and note if there's any odor or presence of clotting. We also want to document our findings and discuss normal progression of lochia. So day 1 to 3 is rubrolochia, which is dark, red, and thin, and increase in flow when breastfeeding, standing, or exertion. Day 3 to 9 is the serosa lochia. It's pink or brown and serosanguinous. Day 10 and up is albalochia, yellow to white, and has a fleshy odor. So non-breastfeeding mothers' menstrual periods may come back within 6 to 8 weeks after delivery. Breastfeeding mother menstrual periods may be delayed throughout the breastfeeding period, and breastfeeding mothers may still ovulate. So we also want to do an assessment of tone is needed to make a thorough evaluation. The last one is the episiotomy and perineum for the acronym. So we want to observe for redness, bruising, and edema. Also the evidence of inflammation, infection, or sloughing in the perineal repair. We also want to check for discharge. We want to check that the repair is well approximated, so the edges are closed up. We want to check if the perineum is intact and look for any hematomas. We want to document our findings. Ice packs can be applied to the perineal area and will help reduce swelling, but do not leave it on for more than 30 minutes. So we would check this area and cover them up, and we'd roll them over. I'm not sure if my bear will do it. And you can check from the back this way too. Roll them back. We want to ensure our client is performing perineal care. We want to change the pads after perineal care and as necessary. And if the client had a cesarean, assess the incision site for redness, swelling, warmth, and other signs of infection. So we want to know, is the incision healing? Is it well approximated? Is it dry and intact? Next, we want to check out the legs. So you want to assess for pain, redness, warmth, or any edema in the ankles or the legs. And we want to check their emotional status. So postpartum blues are related to fluctuating hormones. And also not getting enough sleep and increased anxiety. And the nutritional status, we want to encourage fluids and a high fiber diet, and not to eliminate other food groups. When we're doing our assessment of abdominals, I also should have mentioned that we will have the patient laying completely flat. That's why we don't want a pillow under. It'll make it so that we can't get a proper feel for the fundus. That is everything. That is how we do a postpartum assessment.